Sam Asirvatham, one of the cardiac electrophysiologists. So that's a cardiologist who specializes in heart rhythm disturbances. Most of my work is treating patients who have either a very fast heart rate or a very slow heart rate. And a common cause of a fast heart rate that I do a procedure called an ablation procedure for is atrial fibrillation. Atrial fibrillation is the most common heart rhythm problem that people get worldwide. What it is the top chamber of the heart starts beating extremely fast and causes the lower chamber of the heart to beat fast as well. You remember the heart has 4 chambers, and the bottom chambers are the real important pumping chambers of the heart. They're called the ventricles. And when you think in your own mind about a part of the heart that pumps blood to the whole body, that's the ventricles. But if you think about it, how do those ventricles know when to beat? A lot of people think the brain tells the heart to beat, but the heart has its own little brain, a structure called the sinus node, which is located in the top chamber. Now that usually tells the heart to beat about 70 times a minute. When someone gets atrial fibrillation, instead of that sinus node telling the heart when to beat, about 100 to 500 different spots in the top chamber start competing with each other and no longer listen to what that sinus node is saying. That disorganized, very fast beating of the upper chamber is called atrial fibrillation. Fibrillation meaning that it's beating so fast that it's essentially quivering. Now if the lower chamber, ventricular, the ventricle, ever beat that fast, that would be fatal. But atrial fibrillation is never fatal. Till today, even though hundreds of thousands of people have this disease diagnosed each year, no one has ever died just because their heart beat too fast. So the way atrial fibrillation is diagnosed is with an electrocardiogram. An EKG, if performed, can readily be interpreted and can diagnose atrial fibrillation as being the specific arrhythmia and being different from normal. The reason that someone would be suspicious that a patient has atrial fibrillation so as to get an electrocardiogram would be because of certain complaints that patients would have. The most common is palpitations, just feeling and awareness of the heartbeat. But many patients will complain of being tired, fatigued, not having enough energy all of a sudden. Some patients, especially those who exercise regularly or monitor their heart rate, would notice that their heart rate is faster than it used to be and it's irregular compared to what they used to notice before. In those patients, when they come to a physician or healthcare provider, they'll get an electrocardiogram and diagnose atrial fibrillation. So since atrial fibrillation is very common, just to put it in perspective, that just about every individual, if you monitor them long enough and if they live long enough, will have some atrial fibrillation. In folks who are above the age of 80, 10 to 20% of people have knowledge of, they already know or have been diagnosed with atrial fibrillation. So that makes over 300,000 people living with atrial fibrillation just in the United States. Now, when something's that common, it can't be too dangerous, and we've explained why it is that it's not fatal. But there are some important reasons why you need care for atrial fibrillation. There's 3 of them. One is the risk of stroke. People who have atrial fibrillation are at a higher risk for having a stroke. And we all know that stroke is probably among the most devastating diseases that can affect a person. doctors at present aren't exactly clear why it is that people with atrial fibrillation get strokes. We used to think it's because the blood isn't flowing very effectively, it's swirling around. Certain parts of the top chamber of the heart collect this blood, the blood clots, and these blood clots can then float to the brain and produce a stroke. Now that's true in some cases, but it probably goes deeper than that. What I like to tell patients about stroke and atrial fibrillation is it's a little bit like gray hair and wrinkled skin. They tend to go together, but one doesn't cause the other. If you color the hair, the wrinkles won't go away. Similarly, even though we know atrial fibrillation can cause stroke, we don't know that if atrial fibrillation is made to go away with any of the treatment options we talk about, that the stroke risk will also go away. The main way we treat stroke risk in patients with atrial fibrillation is a blood thinner. In some patients, a milder blood thinner like aspirin is sufficient to help prevent stroke. In others, we need something stronger, a drug like Coumadin or warfarin. The second main reason that we need treatment in some patients with atrial fibrillation is the fast rates over time can damage the lower chamber. This doesn't happen commonly, but could happen in about 5 to 10% of patients. In those patients, by controlling the heart rate or preventing their heart from going into fibrillation, we can prevent that damage to the lower chamber. But in our practice, the most common reason why we will try to get rid of atrial fibrillation or control this rhythm disturbance is symptoms. It's to improve patients' quality of life. If they feel it, if it's preventing them from doing what they like to do, then it needs treatment beyond just preventing a stroke.